The one that I can't find in any of the guidelines is human papillomavirus. It's not even mentioned in the NHMRC guidelines, and I find that intriguing because I am now getting 80% of my oral cancers are human papillomavirus. And anyone that's got kids, boys or girls, you should vaccinate them. You seriously should vaccinate them. There is no reason for people to have either cervical cancer or oral cancer. And, you know, like 80% of our tonsils and tongues are now HPV related. So we'll pretty much finish off with, again, this is what the patients get to hear. Now, incidentally, HPV is transmitted, obviously it's a sexually transmitted disease, so oral sex takes a part, but it's also transmitted by deep kissing. So if it's transmitted by kissing, then it's got to be transmissible from dental instruments, okay? Now, not our instruments because we reprocess them adequately, but it is interesting that there are no infection control guidelines around this particular virus, which I think it's standard precautions, but it's been overlooked in discussions, maybe not for much longer.
So yours a few years back, I was the kid with the...
Brandon, who never spoke, Brandon?
Seems like I got over that and the other problem.
Yeah, you look amazing.
You'd never know that I was the kid with a cleft palate scar.
Or the runny nose or the ear infections. You're like a new man.
It's not just the plastic surgery. That's Lila.
Never met anyone who had a line like that for everything. I find it hard to believe he was actually quiet.
Okay, did you just come down here to show off yourself, your girl?
No, I got a sore throat.
Yeah, from all the talking.
Oh, funny. I have an appointment with Dr. Bennett.
Oh, yeah, let me take you back.
Okay.
Bye. It's nice to meet you.
It's nice to meet you, too. Hi.
How'd you meet Lila?
Oh, she was my lab partner.
My lab partner set me on fire. Open up.
When he was a kid, he single-handedly kept my first practice afloat. His mother called him her little lemon.
She really called you that?
I was sure, even if it didn't help with the self-esteem. Now I have Lila. You know, I bought her a ring. I just need the nerve to ask. Dr. Bennett, is there something wrong?
Oh, you've got a lump in your right peritonsillar region.
Like tonsillitis?
No. I'd like to do a biopsy on it, though.
What is it?
Cancer. It's cancer.
I'm sorry, Brandon.
Am I gonna die?
You're not gonna die. You're gonna fight this, okay? We're gonna fight it. So, what's next? What can we do?
Well, we'll run a few more tests to stage the cancer. Depending on how advanced it is, we can determine the best course of treatment. Chemo, radiation, surgery.
I can't believe this. I've been sick my whole life. I thought I was finally done with it. I'm 22 years old. I don't smoke. How did I get a tumor in my throat?
Well, the biopsy was positive for HPV, which is human papillomavirus.
I thought that was an STD.
It is, but it can cause abnormal cell growth, which can lead to cancer.
Oh, my God.
It's okay.
No, I have HPV. I caused your cancer.
She probably did. No, seriously. We have a patient currently whose husband died of HPV-related laryngeal cancer. She has cervical cancer, and she remarried, and her current husband has tonsillar HPV cancer. So, you know, this virus is not insignificant, and it's a new one on the block, and I've just thrown it in. Okay, so maybe in 1989 we were over the top. Well, we were. I mean, good grief, those instructions I read out. But in 25 years, this infection control has worked, and hopefully this will, bar one lecture next year, be my last lecture. Thank you.